Okay, so good afternoon, everybody. So let me first introduce myself. Voice check. Okay. So let me first introduce myself. I am Dr. Atish, already working in Germany. Uh, I have already passed my FSP exam. Currently, I am preparing for Kenntnisprüfung second exam, and along with that, I am working as a doctor in psychiatry. Okay. Uh, yeah, yeah, no problem. Yeah, no problem at all. So, good afternoon, everybody. For all those people, good afternoon, everybody. For all the people attending the online seminar, also, am I good audible to you, all people? So, am I audible? Sorry, you have to bear with me because it is going online also. So, I have to read those queries also, and then I have to answer yours and these also. Okay, so let's then begin with. First of all, I would like to tell you that I am not associated with any consultancy platform. I'm just a student. People had helped me. That's why we organize the sessions and try to help our juniors or all those people, those who are in the path. So, what are your expectations from me? I have not planned anything. I have had given this day for this thing, but I've just came for 2 weeks. Therefore, I don't get much time to prepare for it. So, first, you can tell me your queries, and then I can, go in that direction. I can focus on those things more, and other things less. Because per se, when there are so many things to discuss, if I start discussing, it can take 2 days only just to discuss those things. Few common question I know. I had also those questions at my time, so I know those things. Firstly, why should I go to Germany? That is, I think so. Is there anybody who has not decided here till now? Should I go to Germany or not? Here also, you okay? Good. On online also.
So
Okay.
you're from dentistry field?
What?
So you're from dentistry field?
No, I'm from MBBS field. Okay. So a couple of questions I'm getting online. Okay. So some of the short answer questions I will be answering at the same time. Others when I speak, so you can get those answers. Okay. So yeah, I'm just asking randomly. I'm getting questions online also, so that's why I'm noting it. So one question I got online, that is German PG valid in India? Okay, so German PG India. Okay. Then after, sir, after B2, how much time will be needed to get job in Germany after FSP and KP? Okay, that I can discuss in the due course. Okay, sir, please. Yeah. Okay. Mhm. Mhm. So that goes in another direction. That is a totally different thing. Understand me? Like I have no knowledge regarding that section. I can tell you how can we work as a doctor. Okay, that also for MBBS students. For dental students, is that the thing is that the number of vacancies is very less. Mostly the hospitals are not there. The public funded hospitals for dentists. For dentists, there are mainly practice or what we call private practice or there. So that is the thing. when you want to do masters in public health and those things, that is equivalent to like when you go through a bachelor's of other or masters of other programs, non-medical programs like engineering and all those stuff. Then I have to research in those sections. As a doctor, we have a totally different uh, roadmap, totally different things. So you don't need to pass all those exams. You don't need to apply in where we apply. That's a totally different thing. So I can give you outline as such, okay, but exact minute details I cannot give for dentistry, okay. I can give almost the procedure is same. The only difference is that your exam must be different. I have heard like we have a first exam of FSP as a theoretical exam, but I have heard from colleagues whose known tools are dentists or dental surgeons. So I hear for them that they have a practical exam also, a practical part tile also, or a part also. So in which you have to do something on the patient or something that I have no knowledge about. Okay. Does anybody have any idea how to obtain a job in Switzerland? Okay, that sorry, I cannot tell you how to obtain a job in Switzerland. This seminar is regarding Germany.
Sir, common question is what is the difference between the medical German and that we spoke that common
Okay,
German
medical
language?
German, common German, that I will tell. Okay. So, after which level should we apply for visa and deposit for that? Okay, which level? Somebody has asked after, sir, after which level we should apply for visa and for deposit beside? Okay, that will come during a discussion. Sir, is there any scope for BHMS in Germany passed from India? Okay, that I can slightly touch it. Okay, but I can't go in detail because that is also done through another path. So everything has a different path. So the one regarding my path here belongs MBBS, BDS, and third one is the pharmacist. So all three these people go through the same path. Other paths are totally different. As far as I know, for BHMS you have to first recognize your degree. I don't know how what's the path, but then you can practice as a private practitioner. That is all. Okay. There are no hospitals supporting that. Learn whole study in German language is difficult. Yeah, that is difficult, but manageable. If you put in your efforts, then you can do. What is your advice for someone aiming for a specialty like dermatology? Okay, that will come. Super specialty branches. Is C2 eine Voraussetzung for psychiatry? Uh, I can say at beginning C2 is not enough for Voraussetzung for psychiatry, but yeah, you need the level of C2. I am already working as a psychiatrist, so I feel the need of the language. I began with my C2 here. Apart from that, I am living there for 1 year. Now, also after 1 year, also I face difficulties while speaking with patients in psychiatry. Okay, so sir, I am a dietitian. Yeah.
My master degree in non-medical field. Sir, how are the university culture scientific combination in science and logistics?
I will come that. Oh, just a second. Okay, done. Surgical and non-surgical courses have the same duration of study. No, that is different. Every course has a different study, and there are credit points. You have to accumulate those credit points. So usually surgical branches are a little bit longer. For example, it is said like surgery takes 5 to 6 years. But sometimes you need more than 6 years to manage those credit points. Okay. Sir, I'm a dietitian and have master's degree. How could I apply in Germany? So, for as a dietitian, sir, I'm extremely sorry. I cannot suggest you, but there can be two things. Uh, and either you can leave, yeah, or you can get your degree recognized, or you can do a small course, small master course for 1 year or 3 semesters. Doing a second master course helps you know the pattern for there, and it opens glycitis at the same time it opens many opportunities for you. Okay, so competitiveness for residency spots now and future projections. Okay, that question is in my list to discuss that concerns about saturation is about saturation. Okay, understand. Surgery 5 in medicine 6, so that we can discuss. Okay, sir, Germany jana worth hai. My batchmate already earning 5 to 6 lakhs per month here in India. Okay, priorities that comes into priorities now. To priorities. Okay, just a second. What is the chance of getting cardio surgery? Okay, branches, ease and difficulty. Okay, how to go about completing started with learning now. What's next? Okay, for doctor who have European degree from Bulgaria, I have license from Bulgaria, India. Should I? License. Okay, FSP. Okay, EU doctors. Okay, yeah.
Explain the credit point system.
Credit point system. There, no, okay. No, but you are asking the another credit point system.
So,
That credit points is like we have here also, na? Like in your PG, you must do this kind of this number of surgeries. I meant those things. So in Indian settings, we get a lot of surgical exposure. But there, the surgical exposure is a little bit of on the lesser side. So sometimes it takes when you are not at a specialized center. So like here we have structure of medical colleges and peripheral colleges. So there is also such things like uni clinics and then small hospitals. So in small hospitals, it can also take place that you don't get so much surgeries. So then it takes long time. Okay, that is regarding that thing.
but where are the boundaries?
Uh, no, no, I'm getting your points. I'm judging that you are asking different credit points. I'm just saying like for a curriculum, it is said that to become a specialist in surgery, you need to do 100 appendectomies. So it can be so different credit points. You are asking like okay, you are asking the now you are asking like CGP and all those things. No, I think
They have credit points scheduled.
that we don't have in doctor's line. That understood. The 10th numbers, 12th numbers, and graduation numbers, all those things. Yeah, that happens in other stream, not in medicine stream. No, that is totally different. Okay, so that is totally different. Okay, okay. So I might have skipped a few questions. So I'm reading from the topmost. USMLE of any use? No. USMLE of no use. Sir, any 1 or 2 year course that can be done in Germany for a good scope in medical field? Ugh, I cannot suggest for BHMS. Sorry. Stipend, yeah, you get stipend. What is the difficulty level of FSP, KP, sir? I am average student, so please guide. Okay, sir. As an intern aiming for conventionally competitive specialty, should I only focus on improving my language skills, or is research also crucial? Research as such plays not a big role. Like in USA, you need research helps a lot. Here, the research helps not that much. The main focus should be on language. I will say that. So, can I work with CV after reaching Germany? You have to pass your exams. Okay, so that I will explain. So, please touch on the process of equivalence of a MBBS degree that I will do. Bitte werfen Sie List auf das Gleichwertigkeitsverfahren wie konnte man Approbation erhalten, ohne KP abzulegen. Okay, that we can do. Can I send my document for approbation without any language certificate? Yeah, but that at least you need one language certificate minimum. So, in which state one should apply for considering test height proofing? Okay, that is a new thing that is has taken place in last 2 months. I will be touching that thing. So I have a fellowship in industrial and as a medical officer. Is it recognized in Deutschland? Are you opportunity to work as industrial medical officer? I don't think so. Anything after graduation you have is not recognized. You have to repeat those things. Obviously, that experience counts. You can get the jobs easily, but as such, even if you are a postgraduate, then also it is not recognized. You have to repeat that thing. Okay. So as such, I have read all the questions on and I think so. I have an idea. There are no new questions. All the questions are old ones only. So please touch upon how to take informed decision while choosing the state. Yes, that is the uh, favorite question. Which state to choose? Okay. As such, you should understand. I cannot help you to. I can directly suggest you a state. I can just enlighten how one should choose for a state. Okay. Okay. Yeah. Any more questions? I will explain the pathway, but depends what you want to know. Okay. Okay. Yeah, that I will discuss. What else? How long does it take? Okay. Okay. Mhm. Mhm. Yeah. Okay. So Gleichgültigkeit, no? Okay. Yeah, you can do that also. I've done that. I've done the same thing. I opted for exam. Okay, that is it depends. I will tell you. Okay, language. Okay. Mhm. Mhm. Okay, that will come. You will be a normal doctor. Okay, you have to start your PG again. Okay. FSP is mandatory for everybody. After Brexit, I don't know the current status. Till UK was in EU. Till then, so only FSP, no KP. Now I don't know if in the new guidelines UK is out from those exempted countries for KP or not. Okay, but FSP everybody has to give in European Union also. Okay, yeah, okay, yeah. That is difficult. The difficulties while learning German, na? Difficulties while learning German. Okay. Yeah. They are different. You have to learn in two languages more. First in Latin also, and in German also. Job access for dental surgeons are not so widespread. You understand? By because it is mainly limited to private practice. Firstly, that is a totally different thing. Actually, here in Germany, the hospitals are controlled by churches and partly by government, a majority by churches. Okay, so in those things, they prefer Christian and church people only in the hospital jobs. You understand that is a totally different line. Okay, do you understand? Like, I have zero knowledge about that. That is totally different thing. Okay,
Translation of the documents,
okay,
application for the business and
yeah. That is same. Only the thing is that yeah, everything is same. Only two things.
What is this?
Yeah, speak that. Okay. The only two things are different. That only the number of jobs are less, so you have
Yeah.
to struggle a little more. That is one thing. And your exam process is different. I envision.
Sir,
little
and
bit.
the books recommended, like, how did you practice there? Like, you started here with B1, B2, and C1, you learned German here only.
I did C1 from here, or C1 from
And
here.
you were learning the medical books, I'm asking more
Yeah.
like.
So I can that I will tell.
Yes.
Superficially, I will not go in so much detail, but it takes a lot of time. And at this stage, you should more focus on your documentation and your German. Medical German, you can start in India also. Many people do like that also. That new thing in order to save time. Or some people have different priorities. Like I did everything full time.
Okay.
I left my job and I did everything full time. I devoted full time for my German and other preparation. Some people keep on working here till the last point and then they do things.
Yes.
And that is, yeah, unterschiedlich. Sorry, German words come more often. That is different and
And
varies
first is
from person
like
to
a
person.
procedure for post graduation there.
Yeah,
That procedure for post graduation. If we are passing the FSP and the KP,
yeah.
how are we going? Because we will start working there. Then how will we doing that specialization?
Okay, okay. Yeah, what is PG? The concept
Yeah.
of
What
PG is a
is
little bit
PG
different
there?
in Germany.
Yes.
It's not like in India. It is a little bit different in Germany. Okay, understood. Okay. So, anybody else any question, or should I start then? Okay. So we begin with. Okay. So I had a question. Why should I beginning with? Why should I decide for Germany? Okay. 1 minute. I can read on the. Is it difficult to get surgical branches in Germany? Not so difficult. Is there any silver line for doctors after pandemic? No, nothing. Everything is getting back to normal. Sir, after doing C1, what solution did you find out for remaining difficulties in communication? Okay, how to difficulties or how to work on German after C1. Will employment unemployment after MBBS internship for 3 to 4 months harm CV if I devote the time for preparation? As such, you can say that I was learning German full time, so that won't harm that much. I have also had a gap in my CV, so I usually say because I passed my C1 B2 B1 exam, so I usually say I was preparing for my German. So that is okay, but you should have something to say for that time period. So I have my exam certificate. That's why. Okay, so first of all, quickly we will discuss why should I go to Germany. Okay, there are many other options also, US, UK, Australia, and other places. Uh, yeah, everything is accepted. Only thing is that everything is extension in internship accepted. Yeah, everything is accepted. You should have only the end document should be there. No problem. Okay, and you should have a legitimate explanation for everything. My first suggestion would be please don't lie about anything in Germany. Okay, like somebody asked for Echtzeitprüfung. So Germans have this problem of verifying documents. In between, it was not done or it was sporadic done for somebody. From last 2 3 months, I am hearing or listening or reading in groups that few states have started checking the documents or sending back the documents for Echtzeitprüfung. That is validity of documents. Okay, so briefly discussing why should I go to Germany? So, going to Germany, I would say the benefits are more on the personal and social life as compared to financial life. So, in English speaking countries like these countries are capitalist. So, the work culture or the load, these things are, you can say, equally as in India. Okay. But in German, the work culture is well organized. You have 40 hours working week. Nobody will force you to do extra work. When you do extra work, also, you are paid extra time. Nobody calls you in the evening time. You get 30 holidays in 1 year that you have to take. Those are compulsory. 30 to take 30 holidays. You cannot skip those holidays. You cannot work too much. That is also when you say, okay, I will work, I will do two 24-hour duties in week. That is also not allowed because your employer he is bound to answer those things. So I would say the social life is more balanced. As a doctor, you can enjoy your life. There is no what would I say? There is no exploitation at work. Uh, Everything is balanced. So that's the real thing to go to Germany. Okay. Salary wise, I think Germany is less in compared to other countries, but the life is really super. Okay. Pharmacist as such, it's difficult to tell the scope because we have very less pharmacists in this. In my journey, I have met only one pharmacist or two pharmacists. Those two, also, they are in Germany, but they disappeared in the story. So, as such,
The next as compared to other locations or as compared to other locations?
less
Less than you mentioned.
as compared to US.
US or different?
As compared to US. Okay. As compared to US, that is the thing. But if you work there also, like in US, you have to like a doctor is shit, no? So that's the thing. So if you work like that in German settings also, you get equal salary. But for that, you have to leave early in the morning and come late at the night. That Germans don't do. They don't prefer that. So everybody loves to live. Yeah, you get Saturday Sunday off. You get 30 offs. So that is a good thing. As a doctor, you can enjoy your life. That is the thing. In rest in other like in Switzerland, the salary is high as compared to that is compared to US. But you have to research on that. How can you even reach Switzerland? Okay, so the work-life balance and the quality of life are the two reasons one should opt for Germany. Okay, then the problem is that coming to language in those countries you can speak in English, so you have everything in English. That is really easy. Here there's added burden that you have to devote some time for the language, but that comes with time and that gets better with time. Okay. So, yet now let's begin. How should we plan? Okay, how should we plan this journey of going to Germany? Okay, so then first thing you have to select a state. Very important question. Yeah, everybody has this question. Then, according to according to the state, just check the website. Okay, check website for all the documents. Okay, at the same time, start learning German. Okay, that is the most important part of your journey. Okay. Don't ignore this part. Coming to German, your FSP exam, I will say 80 to 90% is German, and your KP exam, that is also 30 to 30%, I can say, is German. So you cannot pass both the exams if you are bad at German. Okay. Apart from that, German is very important to get a job. Okay. In interview, only thing that is checked, only thing that is checked in your interview is your German and your interest for that subject. Okay. So nobody will ask you about medical questions in your interviews. Firstly, they want to see if you can speak in German. While because they think if you can speak in German, then you can learn also, or you have good learning capacity, or you can work also. Okay, and then they usually want to know that you are really interested in that subject, so they will ask you, why do you want to do psychiatry, why do you want to do surgery, and all those things. Okay, so do they want written documentation of internship extension, or do I just need a verbal information asking to stay prepared? I don't think so. They will ask you for any written documentation. All they need is the internship completion certificate. Okay. So please tell me about the universities for pursuing PG and what all documents are required for completion of certain levels. Okay, yeah, we'll going through. We will be going through. I will just go superficially because these documents are state specific. But I will discuss, like you can just go on the website and just see the list of documents. Okay, so that you have to do. First select a state and then you have to look for documents and then collect those documents. Some documents you require for application, some documents you require for a visa process. Okay, both these documents you have to collect in the time. Meanwhile, you will be learning German, you will be applying for your deficit beside, and you will be applying for jobs or hospitation also.
So
Okay,
how important is selecting a state? Because most
that is
people
the
say like you don't apply in Bayern or Hamburg or Saarland because the documentations are different there.
yeah.
So
Selecting the state is, you can say, one of the most important decision. Okay, while everything will depend on that. Why I'm saying so? While example in Bayern, the language is or the dialect is a little bit different.
different.
They speak Bayerisch, so
Yeah.
you need to work for 2 3 months to understand Bayerisch. Okay, then the level of exam is also different in every state. Okay, the way or the procedure to get to that exam is also different. Okay,
Yes.
so I will just go through all those things that are required to select a state. Okay, but selecting a state is a personal question. Okay, I am working in NRW, that is said to be the most difficult state. The Kenntnisprüfung of NRW is the most difficult in Germany. It has the highest failing rate in Germany. So my preferences were that my visa interview was in 1 month at that time, and at that time this deficit beside application was really really fast in NRA. I got my deficit beside in 4 days. So that is the thing. Usually you get
Yes.
from 6 weeks to 6 months.
Yes.
So my preferences were that I don't didn't wanted to delay my interview, visa interview. That's why I decided for NRA. At that time, I had thought, okay, I can study more, I can do this, that thing. But the people, those who have time, they can really plan good.
So
Okay.
after FSP, we can apply in any of the state
Nice.
for KP?
No,
No,
no.
we can
You have to remain till KP in that state.
till KP.
Yeah. You can change your state.
And repeat the name of the state.
Which state?
From where you then that's
I'm NRW, Nord Rhine-Westphalen. Okay.
Hmm.
But things have changed in NRW also. At my time, there were 5 medical councils in NRW. So that's why the work was really, really dilute. Now they have united in one medical council. So I had no idea now how much time does it take. Okay. But they are fast in NRW because the things are difficult. So less people apply. That's why NRW is fast. So Bayern is a little bit easier. That's why people are applying a lot. But that is Indian specific. Indians are going to these two states more. I will let you know why. Other people from other countries, they prefer going in the state for Hamburg or the state, the state for Frankfurt. They go to those states. It all depends on many other things also, like social contact. When I have friends there, that is easier to go, and many other things. Okay, so let's get to this question straight away. After KP, you can practice anywhere in Germany. Yeah, that is open then. No, nothing. After KP, you can do anything. After FSP, also you can change your state, but that wastes 3 to 6 months. That is the problem. And one more thing, sometimes they tag you with a what was the term? That wandering doctor, something like that. That when they tag you with that, then it's really difficult to pass your exams. Because they know when you change the state, that means that you want to skip the exam for that state and use the exam opportunity of this state. So sometimes they label you with that thing also. Okay, wandering doctor or yeah, Reisender arts. So that is a negative point for KP exam. Okay, so how to select a state? State. So this question is totally personal. Nobody can decide a state for you, but okay. uh, but I can tell you things that you must keep in mind, and then you can decide. Okay. First is the speed of document processing. Okay. So you should consider how much time do you have, And then on Facebook groups or other Telegram groups, WhatsApp is obsolete as per German point of view. People use Telegram or the Facebook groups. Okay, so I would say start using more of Telegram when you want information regarding to Germany. Okay, that is more suggestible as compared to. Okay, so check the speed, match with your time. Okay, okay. Average time to get a deficit Bescheid is 6 weeks to 6 months. Okay. Second, what do you need? Okay. Ease of processing documents. That is almost same in every state. Almost same in every state. A new thing I have heard from past few past few months is S-Zeitprüfung, no? S-Zeitprüfung. Okay, so that also I've heard from Bayern. Okay, that Bayern has started to do a reality check now. Order, they check your documents. Yes, check your document. So new in Bayern. Okay, but not 100%. So they check your documents, they send it back. It can depend all or some. So they check your documents, they send it back to see if anything is false or something like that. And I had that's my personal experience during my visa interview. Deficit Bescheid was a new thing. Before that, they not used to ask for deficit Bescheid. So I asked during my visa interview, why do you ask for deficit Bescheid? And they have said me that few people from India had given false documents. So that's why we have started asking for deficit Bescheid, because we consider once you have a deficit Bescheid, that means at least your documents have been seen by one authority in Germany. Okay, so that's the logic. So maybe Bayern had some bad experience with false document or something like that. That's why Bayern has gone to one pro level. That can also be because another reason can be because of more number of doctors. So they have choices. That's why they want to be sure that they are getting the best now. Earlier, the things were different. That was the thing. Okay. So the speed of document processing, ease of document processing. Okay.
So most of the consultancies, matlab, most of the consultancies, they just say that we can provide you the correct state for you, that it can ease your process. So that is the main
I'm
quote
telling
of.
you all the points. I'm telling you all the points. You will come
So
to know.
I'm just asking that, do we need any consultation
I don't
for?
need. I've done myself.
Your
I'm
done
taking this
myself.
seminar
Yeah.
because you people can also manage yourself. That's the only thing. In Germany, the thing is that coming to consultancies in other countries, the thing is that these people have links. Okay, so they help you in process. They make the things to be done for you. Okay, in Germany you have to do everything yourself. When you hire a consultant, also you have to do everything yourself. Taking a decision on your behalf and giving money for that is, I think,
They just
it's not.
scare you like if you choose a wrong state, then you will have this longest processing
Yeah,
time. So
yeah, yeah.
that's why we
Can't you
just
see
think
speed
of
of
paying.
that's what I'm said. Speed of document processing, ease of document processing.
Yes.
I've already covered those points. The only thing is that people, they don't want to do the research work. That is the problem. You have to sit, and it doesn't mean like you sit for 10 minutes, 20 minutes. You have to sit for days for this, and nobody will answer you. That is also
Where can you research about different
in Facebook groups. In group, like doctor going to Germany, doctors coming to Germany, international doctors in Germany. In Facebook groups, in WhatsApp groups like LP official for doctors. Those people I've seen at every level. There are 5 to 10 people, and they answer queries. Obviously, I don't get time to answer queries. Life is really hectic in Germany, so I don't get time to answer. But I read and sometimes see that people are discussing and answering things. Okay, I will tell you. There are
So
one or two more
like
points.
where to apply? Like we do have to post our documents.
I will come to that.
Okay.
Okay, I will come to that. Firstly, how to decide a state, speed of document processing. Okay, then ease of document processing. Some state, one or two, they ask for a lot of documents, like Niedersachsen. Niedersachsen, I have heard they ask for a lot of documents. Okay, other things are easy, but document processing is really difficult in Niedersachsen. Okay, but that is a personal opinion. Okay, one or two people had given me that feedback. I don't know that is true or wrong. Okay, then three.
this choosing this field, should I just strictly put my field on Facebook group and somebody will help me with it? Or is there
You can directly ask, you can get random answers, or you can directly specifically ask these questions. How much time does it take for deficit Beshide, okay, to come? So you can get an idea, 6 weeks, 6 months, that, okay. Then somebody will say, don't apply in that state, okay. I got it after 1 year, something like that. Your question should be specific, so that person has the answer. When you will ask which state should I apply, you will observe in 20 comments, 10 people will be laughing or something like that. They will give weird answers. Well, that question is technically wrong. Well, this is a personal question. That is, you can see, you are asking the person, which field should I choose? Medicine, surgery, dermatology, or radiology? Choosing a state is so, like you're asking a doctor, or you are like from dental branch, so, in which field should I do my MDS, orthodontics, or other things? Do you understand? That is totally personal. Okay, that depends on priorities. Okay, so third is that matters also, exam difficulty. Okay, so yeah, everybody has preferences. Like in NRW, the exam is really difficult as compared to Bayern. Why am I talking just about two states? Because about 80 to 90% Indians go to these two states only. Okay, that's why I have a feedback also. There are many other states where KP is really easy, but they are not opted. I will come to that. Why? Okay. Fourth, basic requirements. Basic requirements to get deficit beside. This is the most important point. Okay, and that's why NRW or Bayern is chosen in compared to other states. Okay, you will get your answer now. Which state should I choose? If you are ready to do the hard work here on this point, you have your answer. In few states, the exam is really easy. Okay, but that the problem is the basic requirements. So, I don't know about all the states, but on except on NRB and Bayern, you need a job contract to get a deficit beside. Okay, and nobody is willing to work hard, send mails to so many hospitals from India, because you will get negative answers. You get one job positive application after sending 500 to 1000 applications. Understand? So that's the thing. So you have to work hard for the job contract. If you can manage that, well and good, then you can easily get the deficit beside of that state and you can apply for that state. Okay. That's the thing. Why people are only choosing from India, NRW and Bayern. Okay. And five is that personal reasons. Personal reasons. That is family and friend. So you have to keep these five things. Why only Bayern and NRW is chosen? Because of this thing. In Bayern and NRW, you don't require
Sure.
a job contract. You can just apply for hospitations or jobs. When you get rejection, so you can just cross that in application form that you have intent, and you can show those rejections, and you get the date for FSP. Okay, FSP. That is the thing. Okay. So if you have managed to do this hard work, apply for jobs vigorously. There are few states where on this side of Germany, on east side of Germany, there are states above and below Berlin. Okay, the Brandenburg and all those states. It's really easy to get a job there, but it is difficult to survive there. While in Western Germany, you can easily survive because there are a lot of foreigners. As such, I would say it's not unfriendly, but it is difficult to live there. The things are more, you can say, options are really less as compared to language. I have heard the quality of life is different. I've been not been there, but that is the thing. So if you apply for East Germany, all the states above and below Berlin, I think so Mecklenburg, Vorpommern, Brandenburg, and that state, you can secure a job there. But that thing is that nobody thinks out of the box. So that's the thing. Everybody wants to go to NRW Bayern because everybody wants to skip this part because this part can be tedious. Okay. So that's the thing. You have to keep these five things in mind and then decide your state. Okay. NRW is difficult as far as exam is concerned. Minister is really difficult, both exams, FSP and KP. Bayern is also getting difficult day by day. It used to be easier 4 or 5 years back, but it is getting difficult. Yeah, a little bit level of NRW and Bayern, I would say by NRW is ambition a little bit of more difficult, but yeah, then but the answer here stays personal. Okay, I cannot suggest anybody any state. Yeah, obviously the documentation is fast in NRW. In other states, the documentation is a little bit easier, slower. Neither Niedersachsen you can also opt. There the exam is not that difficult, but it is slow in comparison to documentation. Okay, that's the thing. Okay. But when you are clear with these things, when you do your research on these things, you will get your answer. Okay, but nobody will be able to suggest you. That can be so. Okay, like I say, I would suggest NRW. Okay, take NRW, you will get a deficit beside really fast. Okay, okay, but then you face the exam that is really difficult. Then that matters a lot. Somebody had written also like I am a mediocre student, so regarding the difficulty of the exam, this and that. Okay, let me read a couple of questions and see if somebody has asked some. Please tell me about the universities for pursuing PG. So the process is a little bit different. Is it necessary to do 1 month of psychiatry compulsory in internship? I don't think so. 1 month of psychiatry is compulsory. So it's possible to apply for visa with Eingang Bestätigung for NRW. Okay, I think so. You can apply with. I will come to that point. Somebody has asked apply visa with Eingangsbestätigung. Eingangsbestätigung. Sorry for the bad handwriting. Okay, then please tell me about the website also. What all website one should visit? You should visit websites. Websites. Yeah, that's a good question. Firstly, medical council of that state. of that state. For documents required, then for knowledge, Facebook groups, WhatsApp, and Telegram. In WhatsApp, we have active group. I think so everybody is a member of that LP official for doctors. That group is really active and you get your answers. Unless and until somebody has asked a personal question, really personal, specific question to his or her thing, you get your answers. Easily. I've seen that thing in that group. Okay. Okay. I wish to apply in Berlin. Kindly let me know at Berlin. I'm also looking to play Berlin how somehow Berlin. Okay. So, but the thing with Berlin is that Berlin is saturated. It's really difficult to get a job in Berlin. First thing, the waiting period of Berlin is really long. Okay. So I have a personal experience or a personal known to who didn't get his exam date for FSP. Yet you get a visa for I think so maximum we get a visa for 2 to 2.5 years, and he didn't get a job or he didn't get a job FSP date for 2 or 2.5 years. So the waiting time in Berlin is really long. The rest, everything is okay. If you can manage, if you have a personal preference and you are normal with that waiting period, then you can go for Berlin. It is equally good. Okay. So how can someone get a job without providing their documents? Okay. How can somebody get a job contract without providing the documents? So when you apply, you send your documents. Okay, you send your degree, you send your language certificate, and you write the application that I have applied for medical council or Estekamat or Lageso or so, and in like 3 months or 6 months I will be taking my FSP exam, because in Germany everything is planned. Okay, like it doesn't happen so slow like in India. Some people give the resignation beforehand, 6 months before. Okay, so it can also happen that somebody requires a doctor after 6 months. So you can share your plan, at which level are you, your language level, and then you will be offered an interview via Skype or something like that, or you have to call that person or the HOD, and then after that interview, you can get a job after 1 year, 6 months. That is normal. Somebody says that how can I get a job after 1 year, 8 months? Our in Germany everything is planned. So Germans and people in Germany plan so. Okay, so that is common. Resigning beforehand 6 months. Okay. Okay. So when did you pass your KP? I didn't pass my KP. I'm preparing for my KP. At which language level are you? That people are chatting personally. I in B1 fast track, batch 9 or fast track. Okay, sir. What about Bayern Württemberg? For Bayern Württemberg, I have heard they do a tedious documentation. Okay. When I was searching for my state, so I got 2 or 3 feedbacks that you apply everywhere, but don't apply in Bayern Württemberg. And that was only because of documentation. They do a really tedious documentation. There's no idea. Okay, so what's the approximate waiting period of FSP exam in Bayern? That you can ask in FSP group, LP official for doctors. I think so. That is around 5 to 6 months. I think so. Okay. So right type proving I didn't mean providing. My question is how would I prove that I am competent to appear to interview without even having a deficit beside? Yeah,
So what course do you recommend for learning a fast track course or super fast track
that is
course?
totally a personal thing. Okay, if you are able to give full time, so minimum 2 classes are enough. Okay, if you can manage with 3 classes, that is super fast track. That's really good. Sometimes super fast track gets hectic. So, from my personal experience, I would suggest 2 classes of German class and 1 class of EP, exam preparation. Okay, you lot of things, learn a lot of things in EP also. 3 classes as such for German, then you have a lot of things to learn. You have to revise also. So I would suggest regular or fast track, that varies. Some people learn really fast. So for those people, super fast track. Some people need time. Then regular. Okay. But if you go for super fast track, then do 2 regular classes and 1 EP, exam preparation. Okay.
So what is the difference in like I've done B1, so B2, C1, C2. it's the advanced stages of German or like
See,
medical German?
no. This is only normal German.
Normal
Okay,
German.
medical German you will doing after going there, or you will be visiting another course. You start speaking in B2. Okay, a little bit. You start speaking, saying one sentence is not speaking. You begin with speaking in B2.
In
Okay.
B2.
You
So
are,
the medical German, do they have the levels there for medical German? Just the terminology and
you should need
whatever you use in your clinic.
that is really focused. Do you understand? That is not like in normal German is vast. You have to work in German, you have to survive, you have to do your documentation. So you should be in the position to manage all those things. Okay. So you need basic German to survive there and progress there. The more you will learn German, or better you can speak in German, the more opportunities will open for you. Okay, not only in your focused uh, region, other places also. Okay, things get easier. Living in Germany is really, really difficult. There are a long set of rules. Okay, and every set of rules have or is connected to punishments. Okay, or in form of fines or some other things. Okay, so to master the German is really important for those things to survive there. Okay, and as it's kind of a race, the better you speak German, things will get really easy for you and better for you in long term. Okay,
So do you
obviously,
recommend like a part-time jobs? Like people say like doctors, they don't do part-time jobs
doc-
because they do have lots of studies to do
yeah,
already.
yeah. So I would not suggest any part-time job in the beginning. In the beginning, I would say you master your allgemein German or the basic German, and then medical German. Only these two
Okay,
things.
well, you have to
Yeah,
focus that.
instead of doing a part-time job, I would suggest do a hospitation,
Observership.
the
Yeah.
so-called observership in US.
Yes.
Okay, I will come to that.
Okay.
How to apply for visa, I will come to that. Passing rate for FSP. Uh, I don't have any passing rate for FSP for NRW, but with a good language grasp, I have just seen all those person who could speak good of in Deutsch have passed. No one has failed. The only people I have seen who failed were those who were not focused in preparation, or that they didn't practice, or the grasp of language was not so good. So for FSP, it is 80 to 90% German. Okay, now, sir, I typed providing. I didn't meant providing. My question is, how would I prove that I'm competent and appear for interview without having a definite beside? Okay, so one thing in German, when you get an interview, okay, I'm not talking about big clinics. Okay, I'm not talking about unique clinics or those things. There, it can be that these people have the liberty of choosing. That's why they call multiple people. But in Germany, when you get it is so said, when you get a job interview, the things are almost done there, while they because they read your CV really good and they consider all those things. The only purpose of that interview is that they want to see if you can speak in German, and what are your plans, are you serious about those plans. Those are those things. So in interviews, proving is not uh, I have not seen that. Okay, so I am asking in relation to the current job contract before DB in some states. So it happens, like I said, people have requirements, and in those regions, doctors are less. Obviously, if you apply with a big city, you won't get before I can say before FSP. Living in Germany also, you cannot get a job contract. But if you start applying small states, you can get. But that's difficult. You have to work hard. That's why NRV and YN are so popular. Okay, if NRV and YN also does that, you need a job contract, then things will change. Okay.
So how to Yes, sir, how to apply for deficit based side? Because I've seen something funny like it needs 3 to 6 months to
Yeah.
get a deficit based side, but the good standing certificate they need a validity of 1 month
Yeah, I
and
will
the
come to that.
police verification
Yeah,
for
I'll
one
come to
month.
that. So her
So
question is timeline for documents, like it takes 6 months to get a deficit beside, but the validity of good standing and PCC is for 3 months only.
yes,
Okay, so
somewhere I read in it's like
approximate time for
1 month.
FSP in NRW somewhere around 3 to 6 months. It depends on what is happening and season and all those things. I am asking in relation to requirement of job contract before so do they make interviews? Yeah, some hospitals take interviews for hospitation also. Yeah.
B1 in German, the level, like
No.
Should have
Minimum B2, preferably C1. B2 is enough just for application, language level. That minimum C1. After C1 also it's minimum 6 months. Then you get fluent. Then you start understanding things. Then you start producing yourself. Okay.
Yes.
Okay. So minimum 6 months after C1. That will I say. You need while there is dialect also and many things. Here you learn. Here we learn Hochdeutsch. Hochdeutsch is that standardized German also. But we have what we say Umgangssprache, yeah, the local language, colloquial language, that is totally different. They use same different word for all other things. So you get a shock. Like I was really confident. I had started with my C2. I had done my C1. I was really confident, and that was shock when I reached Germany. Okay, I cannot speak also fast. I cannot understand. I have to think. And here, what we do is all is controlled. Okay, you think of topic, you think of words, you make mind map and all those things. But speaking on street is totally different. But it is manageable. When you are focused, it is manageable. Right time to do hospitation after B2 or after FSP course. That is, I will say, no correct time. Both the times are equally good. After B2, basically, so how does hospitation help? Okay, that's the question now. For time of hospitation. So after B2 or after FSP course. Okay, so I can explain you what's the difference, then you can decide yourself. After B2, thing is that you won't be after B2, you won't be knowing any medical German. Okay, no knowledge of medical German. But after FSP course, you will be having a knowledge of better knowledge of medical German. So that offers that you can get better understanding. Better understanding. Okay. Then you can communicate with patients also. Because in FSP course, you learn medical German. So what is this FSP course? Okay, so I'll come to this FSP course or prep course or prep you can do yourself also. So you learn medical vocab. Okay, medical vocab, that is medical terminology in German. That has around 2000 to 3000 words minimum. Okay, then you use radiometals. Metals. Radiometals used to talk with patients or the history taking, in other words, history taking. Okay, so after this course, FSP course, you can go to hospitation. So you can absorb a really good thing, you can understand well, you can produce well also. After B2, it will improve your German, but you will not be able to exactly use, while because you don't have this history taking knowledge. Okay, so medical terminology you won't understand when patients say ich habe Schmerzen or something like that. So I would suggest that will be better after FSP. After FSP preparation. But other way around, many people do other way around also. Because you observe passively a lot of things. Personally, I feel. Okay, but that is totally different. Many people just do this hospitation and then take the exam also. That is also manageable. Okay. Sir, is the roadmap different for foreign medical graduates and Indian medical graduates? Is there any validity for B1 certificate? Okay. So the roadmap for foreign medical graduates and Indian medical graduates, that is almost the same. Roadmap is almost the same. Can we do one thing? Okay, like these are the topics which I will be touching. Now, in between, when I answer to these questions, it breaks the continuity. can we do one thing? I just deliver all the touch all the relevant points, and in the end, then you can ask the questions. Okay, like I had to touch this hospitalization thing in between. Okay, so like it's like going everywhere in sporadically. Yeah, it's breaking the link. Okay, so I'm just talking for the online students. Okay, so okay, so firstly, please listen me for a while, and then I can answer your questions or specific questions. Okay, like that, I'm losing the rhythm like in between answering those questions. Okay, I'm okay. In den einen Eigenhalten ohne in Deutschland zu sein, die Krankheiten bis zu solchen kann die hospital before and after internship like in US. No, there is no problem. The difference in Berlin. How to apply for job application in München? How long is observership? Okay. Okay. So where were we on just a moment? Okay. So now you have decided your state. Okay. So now you have decided your state. So you begin with German. Collect your document. Collect your documents as per state requirement. And third thing, keep a check on visa interview waiting time, and prepare your timeline because the path pathway is really long and tedious. Okay, so to begin with point number one, begin with German. You start studying German. Okay, and my suggestion, which level is enough? Is a wrong question. Okay, no level is enough. Till now, I also feel I need to learn a lot more. Okay, so my suggestion will be don't stop learning German. Okay, till end. Till end. Okay, don't stop learning German till end. As the time when you take a break of, like many people, what they do, okay, that once I reach Germany, then I will do after B2. Okay, or the C1, because I will learn there fast. Okay, understood. When you stay there, so you learn fast, but when you take a break, you go back behind. Okay, you lose all your knowledge. And the most important thing, like people asking which exam is difficult, which state is easy, this, that. If you had a good command of German, if you have a really good command of German, in German, nothing is difficult. Okay. Because like in other places, like I have engineer friends, they don't require German that much. Okay. But here you have to, when you will be preparing for the exam, okay, You will have to speak in German, you have to write in German, you have to talk in German in your exam. After that, when you will be preparing for your Cantonese Prüfung exam, then also those things apply. When you work, you have to speak with patients in German, you have to write case histories in German. Okay, those things are really then problematic when you don't have a appropriate knowledge. Okay, so firstly we begin with German, then you start collecting all the documents. Okay, start collecting all the documents. So you have to see document for two places. Okay, first is medical council to apply for deficit Bescheid. Okay, to apply for deficit Bescheid. And second is for visa. Why I'm saying visa? Because I think so for medical council you don't need a birth certificate, but for visa application you need that. Okay, a lot of people are not having their birth certificate, those things. So I mean to say, prepare a list of all the documents that you require for applying for deficit Bescheid, and secondly for visa interview also. That is your birth certificate. That is really important. I see a lot of queries that I have there is no name in my birth certificate, or my father's name is missing, and that is a really tedious process in India. So you have to do all those things gleichzeitig order at the same time. Meanwhile, you are learning German, you are completing your documents, and as soon as you complete your documents for your medical council, plan to take one exam. Plan to take one exam according to your level. To your level, like A2 or B1. Okay. Plan to take one exam. Why do you need that exam of A2 and B1? Okay. So that you can apply for deficit Bescheid with this exam. Okay. So when you apply for deficit Bescheid, you get Eingangsbestätigung. Eingangsbestätigung. What's that? That is basically the acknowledgement slip that your documents have reached Germany to medical council or the Arztkammer. Okay. So you get your Eingangsbestätigung. With that, you can apply for your visa. It depends on dealing officer and embassy. Sometimes what they do? They process your visa application. Other times they say, okay, we have accepted. We will start with preliminary Bearbeitung or processing, preliminary processing, and but we give you 2 months time to submit your deficit Bescheid, or we will process your application, but you need to submit your deficit Bescheid in course. So somebody had asked how much important is Eingangsbestätigung? Can we apply with Eingangsbestätigung? So that's the answer. It depends on dealing clerk and embassy and Ausländer Behörde. So there is no such, as in Germany, there is no such specific rule. It all depends on dealing officer. Okay, Ansprechpartner, we say like a dealing clerk or dealing officer. So he will decide whatever he thinks according to the rules given is correct. So it can be processed, it can be rejected. It can also be said, okay, we are taking your application, we are not rejecting it, but in the due course, you have to give the deficit Bescheid, and then you can send that response to your corresponding Arztkammer or the medical council in Germany, that I have been asked by the embassy to submit my deficit Bescheid. Please send me that. That helps, or that can help you or not help you in faster processing. Okay, so that's the thing. So you collect your documents. Meanwhile, keep learning German. Then give one exam, not B2. I'm not saying wait till B2. Give with A2, B1. The thing is that you can save time. Sometimes when you apply for deficit Bescheid, this Arztkammer can also say that no, we require a B2. Sometimes you get a deficit Bescheid saying that you have to give FSP, KP. What is deficit Bescheid? Deficit Bescheid is basically your
Missing documents.
yeah, that is the document you received. You must understand deficit Bescheid is not a, you don't apply for deficit Bescheid. Okay. So here I come on a very important thing. There is nothing like application of deficit Bescheid. There is nothing like application of deficit Bescheid. Okay, it is an application for approbation. Okay, that is the thing. You apply for approbation, you don't apply for deficit Bescheid. And then that your application is evaluated. Okay, and missing documents. Missing documents or requirements. The document you received is called deficit Bescheid. So sometimes with lower language, you can also get a deficit Bescheid stating you need a B2. Sometimes they will say no. We have taken your application, but it will be further processed, or you will get a deficit Bescheid when you give your B2. Okay, that is now why have we done those things? Like we have applied with A1 or B1, while this application part is also long. Okay, that takes a lot of time. You need to collect a lot of documents. That's why to win a time of 3 to 6 months, you apply with A2 or B1. That's the thing. Okay, the application part is really long, so you save your 3 to 6 months, you apply with A2 or B1, so that if you get a negative response also, in the meanwhile, you have saved that time. Okay, while you will translating those documents also, then you will be getting it attested from your embassy also. So that is a very long procedure. So in order to win time, you apply with lower languages, lower levels. That is my suggestion. Personally, in my case, my document collection took a really long time. Took a really long time, and by that time I was done with my B2. So I didn't have to face that problem. But personally, I would suggest that. Okay. Now, list of documents that is state specific. Mostly you need degree, mark sheet, then degree, mark sheet. I think so. 10th, 12th, I don't know. One from these, birth certificate, internship certificate, internship, language, and what else? Medical council registration, medical council registration, then PCC, good standing, good standing, and
So detailed CV or
CV,
job experience.
CV, CV, your CV, police clearance certificate, police clearance certificate. Okay, you have to get your passport updated, passport. Then what else? I think so. These are basic documents.
Work experience.
Work experiences, yeah. Those are personal things. Work experience. So these are the list of basic things. Apart from that, things are state specific. Some states ask for one or two more things. Some states ask for one or two less things. That you have to check from your list. You can easily get. That is called merit plot. Okay, you download the merit plot. All the information required to application is given in that merit plot, along with application form and everything. Okay, you just translate those points and all those things and are done. Okay, so you collect those things by, for example, you make your CV. Okay, so coming to next, yeah, from where do you make your CV? Okay, so there, one is Europass website, and second is lebenslauf.com. Lebenslauf.com. So, okay, you need not ask anybody to show the experience. That is software based website. You just fill your information, just translate that in German a little bit and fill your information, and it generates your CV. So you use that site and prepare your CV. Okay, documents and all those things you can do. Language you will do. Medical council registration you will have. Okay,
So translation of the documents.
coming to that point. I was just reading the
Yes,
questions.
yes.
Does having a spouse who is already working in Germany change any of these process? Does it give any advantage or are they possible? Okay, Erstzeitprüfung and spouse. Okay, so I will come to these two questions in the coming time. Okay, let's continue here. Okay, so we have discussed the documents you have to collect. Okay, let me just go through what all we medical council visa plan to take exam according to. Okay, that we have discussed. Documents as per state, you're going to keep a check on visa interview. Okay, that is really important. Lot of things depend on visa interview while in Delhi because in Delhi, because in Delhi waiting period is really long. I had waited for 8 months for my visa interview and I had got my visa now after 13 months. So just a visa application wasted 2 years of my journey. So you should keep all those things in mind. One more thing, when you're waiting for your visa reply, lot of people stop preparing and start waiting. So please use that time also to learn German. Okay, learn German and start reading the medical vocab. Okay, medical words and all those things. Start learning and reading those things. Okay, so based on those things, you have to prepare a timeline. Time is really important. Okay, so now you have collected your documents. Okay, you have prepared your CV. Now, favorite question, attestation. Okay. At my time, attestation was really easy. That used to be walk-in, 10 euros for 10 documents and then 1 euro for one document. I think so. Attestation of document has gone really difficult now. I get a lot of questions regarding attestation. That has gone expensive also. Yeah, I think so. It costs around 20,000 to get the
Yes, sir.
documents attested from embassy. Okay.
Yes.
So you have prepared your documents. Now you require attestation. You can get your documents attested. Okay, why do you need attestation? Attestation is needed because entweder, I mean either you can send all your original documents for application, okay, or you can get them attested, photocopies, and send those attested document for application. Thing is that these medical council lose your documents really often. Okay, you will be asked in due course also to submit I know 1 or 2 documents again. Okay, so the thing is that when you have sent your original degree and that is lost, what will you do? So a lot of people have posted this question, why should I pay 2000 rupees for attestation? I can send original also. So those 2000 rupees are only to save that harassment when your degree is lost. Okay, that's the problem. You get the document attested so that you don't lose your original documents. Okay, that's the real idea behind it. You can send your original documents also, but there's no guarantee. Things almost everybody is asked to send 1 or 2 additional documents again and again. So that's the logic behind attestation. Okay,
So these are attested by the
German embassy. So I don't now. My time was that you had to just go and walk in as a walk-in, and you get those attested. I think so. Yeah, for nowadays, you apply at VFS, take an appointment, submit the documents in VFS, then those reach German embassy. Then you get after 1, 2, 3 weeks, and you have to pay for that also. Okay.
Okay.
So that's the concept of attestation. Why do you get your documents attested? And yeah, to save your original documents. You can send your original documents also. So, that is totally different. Understand, like adjusting to German culture, some people find it really difficult. Some people say, 1 or 2 friends of mine say, मैं तो बना ही है अकेले था. Okay. Thing is that German, it is really difficult to make friends. They take time, German, to get friendly with you, 1 to 2 years. But once they are friends, they are really good friends. So first 2, 3 years is really difficult. Then the social rules are different. Everything is strict, controlled, and fine. So that's the thing. So that is a totally different. Some people find it really good. Some people say,
This
"Nahin,
is
it's
your
really boring."
personal
Really personal
experience.
thing.
Some
Really
people are
personal
very
thing.
friendly and some are
Uh,
a little introvert.
Doctors have no campus. That's the thing. That uni campus I have seen, they are really good. Facilities are good. Everything is subsidized. Everything is almost free. Really good, and campus life is really good. No racism at all. Things are good as far as I know, but I have not lived that life. As for doctors, it's still different. For doctors, we don't have a campus life. We have to we have a working PG. Our 6 years job with those credit points is equivalent to PG. We don't visit any university as a doctor. So that's a campus life. As far as I have seen, people are really satisfied with campus life. You can work, you can adjust your, I think so, classes also. You can take forward, backward according to your load and according to work requirement to those things. But those things are from doctor side are different. That's the thing. Okay. Now, that's totally different. That is not concerned with doctors. Like that is totally different thing. Okay. So does have any spouse? Okay. I will come to spouse question a little bit later. Okay. Erstheitprüfung. Okay. So once you reach, no, I'll come to that. Okay. So one now you have got attested. Next step is after that sending those attested documents to Germany. Okay. Where in Germany? Okay. Where in Germany? So you send them translator. Okay. You send them translator. Translator will translate those document. Either they can directly apply for you, or they will send to some known of you, and that person applies for you. So that varies from person to person. Okay. You send your attested document to translator. So that person directly applies, then translates, and then applies for you. Or some translators refuse to do so, so they send you either back. That is not a good thing. Or they ask you for local address and they send to that person. That person applies for you. What all need to be translated? Okay. Directly to in our system, we don't have any university system. That is totally different. That is through I think the DART and all those things. No? That is a totally different thing. Okay. And what is this application? This is not an application for admission. This is application for deficit for approbation. Okay, that is a totally different thing. Yeah, this is not an application for admission. That is the application that I want to get my degree recognized and work as a doctor. This is that application. That is another application that you're talking about. Okay. So applies for you. So what all needs or what all document needs to be translated? So except for your language certificate, that is already in German from Goethe, and PCC, everything else need to be translated. Translated. And one more thing. Now there's a technical glitch here. Usually it is that PCC doesn't require translation, but the thing is that these translators are notaries in Germany also. Okay, so they translate and attest again. Okay, first attestation was just to send to this translator the attested original copy, okay, attested copy of your original document. That was not notarized or that was not recognized there. Second thing is this translator also verifies and seals what we say like notarization. They do that thing also. The thing is that PCC is an original document. That's why it doesn't require notarization, but it requires translation. Okay. So I would suggest you go for translation also. Okay. And I would suggest you go for this stamping of your B2 certificate also. Okay. When you get a response that okay, your language certificate is not notarized or something like that, then you send again from here. So I would suggest you in that bulk only go for translation stamping for all the documents. Okay, in spite of the fact it is said that these two documents, while your PCC has a stamp of Ministry of External Affairs, and that doesn't require further attestation. But to save, yeah, that is like 1 or 2 in 100, but that can happen. So to save that time and harassment, I would suggest. But I hope you understood the concept yet. Now, behind the attestation from embassy, then translation, and then getting that translated document again attested, and then sending it for you. Okay. So when your translator agrees for that thing that it will apply for you, then you fill your form also. Fill your form, and that you also send along with those attested copies. And he will translate and again then post it to your medical council for deficit prescribed. Okay. The list of translators you can get usually write on LP official for doctors. I will not write the name of somebody personal here.
So except this language certificates, everything needs to be
Yeah,
translated.
obviously, everything needs to be translated. First thing, and second thing is everything needs to be stamped again, attested or stamped. Right. That's what I mean. Na? Usually,
Yeah.
the thing is that PC should be sent original, but you require stamping or sometimes a translation. So there can be a person in medical council or IST Kamar that doesn't understand English at all. Then that can be a problem. So once a thing is translated, then it should be again certified or notarized. That's the thing. Okay. Okay. Now, one question arises: this PCC, and the second was good standing certificate, na?
Yes.
Good standing certificate.
They have this
So their validity is of
So
3 months.
somewhere it is written like less than like validity of 1 month, or somewhere it is
Usually
written
of 3 months.
3
I have heard of 3 months only. Okay. So how to play with these things? So just see from where are you applying? From where are you applying? Now you have experienced people from every state, almost every state. So you can get that answer. How much time does it take to get the PCC and good standing from your state? So just calculate the time to get from that state. Okay, so you calculate the time, you match with the time of application. What I mean is here, example, you have decided to apply in Jan, okay, and your application for PCC and good standing takes 3 months. So you just apply 3 months beforehand. Okay,
So I didn't
you have to do that timing yourself.
get.
I just mean that you just inquire in your area from your passport. Okay, PCC can be applied from two places. Okay, either from passport office or from police station. When you apply from police station, then there is no stamp of Ministry of External Affairs, and you need to get that notarized and all those things. Okay, but when you apply from passport office, then you get a stamp of MEA. So I meant is that sometimes it can take long, sometimes it takes only 1 week. These appointment you have to apply for a pass in a passport office. You have to take an appointment. So you manage your timeline accordingly so that you get 15 days earlier or 1 week earlier before applying in
No,
Germany.
I meant ki if I have sent my documents, like for deficit, I have sent my documents with the PCC, but the time of processing that they are sending me back the documents are Eingang
Bestätigung.
so it's 3 to 6 months in that month.
The date is important at the time of application.
Acha, date
Okay,
of
so
application.
when you apply, your PCC should be not older than 3 months. Okay. So you have to, in this thing, you have to, how you have to deal with this thing. These things require a very less minute translation. Okay. So you send all of your bulk of documents to the translator by post. What happens that these translator will, what will they say? Like you send long document, your degree, your experience certificate, which has a lot of 2-3 pages or something like that. You talk with your translator. Okay, you send by WhatsApp or by email. These are these documents. Okay, she will give you an estimate, or he or she will give you estimate. You pay for that, and you get, like, out of 20 documents, you get 16 documents translated. Okay, she will not give you the copies, or she will not send you copies until your original copies reach there. However, what will happen? Out of 20, your 15 or 16 documents are long, that requires 1 or 2 weeks of translation. That will be done. These documents have only one line. Like, Indian government of India have no objection that doctor, he or she goes to Germany for long-term visa. One line is 1 minute or 5-10 minutes work. So you manage with that. You start talking with the translator, send those copies online, pay for those things. When these documents, when you're finally collected with all the documents, then you send together everything by post. Okay.
Okay.
Okay, understood.
Yeah.
So yeah, that is also complicated. You have to manage the timeline. That is really harsh. Okay, sir, can we send the person medical license registration in original after getting stamp from? Uh, yeah. So nobody has done this, but I'd logic know what to say. Logically saying, you get them stamped from embassy just to save your efforts. So when you send them original, then you don't require them. Okay, so you can send them, but nobody has done this. Okay, so that's, I'm just talking about logic. Everybody gets that attested from embassy and then send them. Okay. One more thing, many authorities in India issue nowadays electronic certificates, like good standing certificate. You get it from Delhi Medical Council also online. So everything you get online. You have to submit that online document to the concerned authority and get it stamped and original signed by that issuing authority. Okay, that is a really important thing. Whatever you get online certificate. You have to get it stamped. Okay, try getting a birth certificate also stamped by from your what do we say? Who is the issuing authority? Municipal corporation office or a medical officer in rural settings. Okay, so try getting all your online documents signed and stamped originally from the issuing authority. In the German embassy rejects the online issue documents. Okay, because in Germany that is not a popular thing, so they think that is not a thing. So from there we get a good standing certificate. You apply from the medical council you're registered, state medical council you're registered with. Okay.
So what about the medical we have to undergo? People say that it has to be done in Germany.
No, that is you can, if somebody, some of your colleague here, doctor colleague, agrees to sign that thing. Okay. So no need to send that thing when you apply for FSP exam.
Yes.
Then you again get a list of documents you need to send to the Aste Kamarao. Again, they will ask you for your updated CV. They will ask you for measles, I think so also, and then doctor certificate that you get. Then there you can go to Hausarzt. It costs 10 or 23 euros, and you can get it done and sent. That you require doctor certificate or a medical fitness certificate you require in Germany. Don't worry about that. Nothing will. Germany, yesterday I have read that Covaxin is also accepted. Covishield is accepted. Covishield was accepted. I know that. Okay, yesterday only, or somebody today has posted in the group only. The LP official for doctors that Covaxin is also accepted. I'm not sure. Now the things are casual. Earlier they were really strict. Okay, the document, sir, the document should be translated into German before applying for definite website. Yeah, obviously, nobody understands English there. So timeline is collect your documents, get them attested from embassy, send them for translation. The translation is not only translation. Translation is translation and verification. So they are notarized also from the translator. So, and one more thing, translation from India is not valid. Many people write that, can I get it translated from Delhi University? Can I get it translated from Max Muller Bhavan? Can I get it translated from German authority in India? No. There is a list of translators only in Germany. These translators are not outside in Germany, so you have to get it translated from them. Translation costs around 20 to 30 euro per page. Okay, that is the thing. Okay, now coming to a small category of thing. Some people have asked me also, and I wanted to touch that thing also regarding curriculum and regarding Gutachten, curriculum, Gutachten, and foreign medical graduates. And what was the pathway for Indian medical graduates and foreign medical graduates? Gutachten and curriculum. Okay, so these were things. So when you apply for approbation, you have two processes. FSP everybody has to give. Okay, that is an easy exam. That is to check your German language, not the German medical knowledge. In that exam, they just see that are you eligible or you are competent enough to work in hospital, or I must say your Deutsch is good enough to work in hospital. Okay, so in that exam, more focus, 90% of your focus is of German. Okay, you can say the wrong things, no problem. Obviously, don't make a blunder. Like the example, when somebody asks what you will do for fever, you don't say antibiotics straight away. You have to say PCM and investigation or something like that. So obviously, if you say something wrong in that sense, obviously you will fail. But for like diagnosing a patient, usually you are not failed when you have spoken good in the exam and you have showed empathy. The main concept of that exam is showing empathy, speaking good German with patient, and understanding everything. Okay, so that is required. I will come a little bit later to that requirement for that. So now, when you apply for approbation, you have two pathways. Either you can opt for directly taking the exam that will verify your medical knowledge, that is called Kenntnisprüfung, okay? Or you can also apply for Gleichgültigkeit. Gleichgültigkeit means that you are giving your documents for equivalence test. Your documents will be checked. You have to submit a curriculum for that, and then after that you get a response. You can get a positive response, you can get a negative response. Okay, chances of getting a negative response are increasing day by day. Okay, so when you get a negative response, you have to give a KP exam. Okay, when you get a positive response, you don't have to give a KP exam. Procedure for that is you have to apply for curriculum. Curriculum is a list of all the topics you have studied in your MBBS time. Okay, that is around 300 to 500 pages with all. Kindly understand the difference between mark sheet and curriculum. Hmm? And there is one document in between. Mark sheet is only the subject and the marks, and there is one, some colleges or universities issues number of hours study. That is a 4 or 5 page document. Each subject number of hours study. That is not a curriculum. Curriculum is minimum 300, 400, 500 pages, which contains, example, anatomy, how many hours, and all those topics studied in anatomy. Okay.
It can be obtained from the university.
Yeah, you
or
have to apply for
for the
university.
university.
So usually you apply for dean's office or something like that. When
But it
university
is,
says or college says that we have no idea. I'm talking for Indian graduates. It's when
so it is needed for the equivalence.
equivalence, when you want to equivalent. Okay.
Okay, if we are giving FSP
When
and
you
KP, then it is not
when you opted for
needed.
KP exam, then you don't need for that.
No.
Okay.
Okay.
So yeah, so question asked is time for equivalence. Usually a response, a colleague from mine got a response after 2.5 years. Okay. And now we get a visa for 2 to 3 years to do all those things. The thing is that when you get a negative response, you have only 6 months to 1 year of time to take the KP exam, then the pressure builds up. And the chances of getting with the Indian curriculum at the present time is very less. Those passed from previous USSR countries like Ukraine, Russia, or though that curriculum was equivalent, that is equivalent to the study curriculum followed in Germany. But it can matter that some topics are less taught, some topics are more taught. So those people who pass from those countries have a higher chance with 6-year degree. What I mean, not China, but a former USSR degrees. 2 years average, 1.5, 18 months to 2 years, 18 to 24 months. You got to reply. You have to wait for that much time, curriculum time. That is average waiting time. Okay. So one more thing, when you apply for Gleichgültigkeit, now you have to get those 300 pages also translated in German. So that is an extra cost. Okay, 300 pages means 5 to 6,000 euros, 6,000 euros, and that is again with time, with cost also, and the chances were day by day, because earlier the pass rate was high in Gleichgültigkeit, but nowadays the pass rate is less. Yes, when you do a PG degree, when you attach a PG curriculum also along with it, then the chances of getting a Gleichgültigkeit increases because your clinical credit point increases or something like that. I have observed, or that is so with PG curriculum also, you get that equivalence for MBBS with a higher chance. Sir, we apply for Berufserlaubnis or for approbation, or both in a single application. You apply for approbation when you pass your FSP exam, then you apply for Berufserlaubnis. With that Berufserlaubnis, you can work for 2 to 3 years, and with that Berufserlaubnis, you can work for 2 to 3 years, and at the same time, you have to prepare for a Kenntnisprüfung exam. Okay. Transcript is something different. Transcript is a small thing that contains of subjects, marks and hours. Yeah, that subject,
All the
marks and hours. Curriculum is detailed. Transcript is of 3 to 5 pages. Curriculum is of 300 to 500 pages. Okay. People are really confused. Should I send my transcript? No. Transcript you have to send for application of approbation. That is mandatory. But for Gleichgültigkeit, you have to send your curriculum. Okay. So curriculum is an expensive process. Gleichgültigkeit charges are also 600 euros, and then you have to pay for translation also with a long waiting period, and then also very less chances to pass. Okay. Yeah, so what I want to say that if you want to apply for equivalence, just pass your B1 exam, A2 exam, and apply for equivalence then, because you will take 1 year to reach Germany. So by that time you pass your FSP, you will get your answer. So just do it in the beginning. If you think you pass your FSP and then apply for equivalence, or when your visa comes, then you apply for equivalence, that doesn't make any sense. Yeah, approbation.
So suppose now I do next. This decision decides that I will get DB give me or not. That is what I was. Like my question is, if
You mean to say the processing time of DB divided by shite, huh?
is it inside the processing time includes the equivalent?
That is totally different. You can get answer that okay, you will get a deficit beside after your curriculum is evaluated. You can get that also. You can also get that initially you have to pass the FSP exam. KP will be given that. So it can happen both ways. Positive also, negative also. Understand? There is no set of rules in Germany. Anything can happen. Anything can happen. Now, I have also seen two people passed from the same batchmates, passed from the same university, same curriculum. One was matched, one was not matched. And you cannot challenge that thing in Germany. Yeah, same thing. So that cannot be challenged in university. That cannot be challenged also in university in Germany. Same curriculum, batchmates. One got positive response, one got a negative response. Okay. So that is so much different in Germany. So when people ask me, na, what will happen? No, I cannot say what will happen. Okay, I can just tell you all the positive outcomes that can happen. Okay, you have to think that yourself. It can also waste your time if you when they say that you will get deficit beside after 2 years. So when you
decision I can make after getting my video.
yeah. Okay, somebody has asked for Saarland states I have already discussed. I know why Saarland is preferred. In Saarland, you don't need FSP exam. Okay, that's why Saarland is Saarland and Hessen. These are two places where FSP is not required. Okay, very good. you can pass your, but you need require one B2C1 medicine.
Okay.
That is like, we prepare for Gyothe, something like that, B2C1 medicine exam. With that, you can apply for jobs. But one thing is set in Saarland, with every HOD, there are around 500 applications for job. Everybody applies for Saarland. So that's why, I don't think so. Now people are applying after FSP also in Saarland. So they prefer more one. Yeah, TELC, somebody has been TELC. So when an HOD has somebody with FSP passed, he will prefer FSP pass instead of only B2 pass or TELC pass.
But after FSP, how quickly or how immediately will the KP exam? Do you have to go for
Usually you get 2 years time,
years.
2 to 3 years
Okay.
time.
it depends on within a year or within 2 years?
Yeah. Usually the result of FSP, it is written your FSP result is valid for 3 years. So everything is based on that 3 years. Okay. You can work for those 3 years, you can prepare for those 3 years. The question was how much time you get for after FSP exam. Usually FSP result states that your FSP result is valid for 3 years.
So attempts for FSP is
Unlimited. Attempt
unlimited,
for
but
FSP,
for KP
KP
is
are only
free.
3. Yeah. Okay.
And FSP is valid for like two
3
years.
years. 3
3
years.
years.
What is the reference Gutachten? No, I have no idea regarding reference Gutachten. I think so. That is Erstzeitprüfung. So reference Gutachten is evaluation. Okay. I would not suggest Saarland. Okay. Saarland used to be a good choice in 2015-16. Not in this time. Okay. Saarland was a really good choice in 14, 15, 16 because no FSP KP was required. Directly go and join there, but not in this state with so much competition. Okay. Everybody there will be better, or I would say they are very good applications there. That's the thing. Okay. So when you start with Saarland, then you waste your time and then you go for another state. So don't waste your time. S-type proofing is a new thing. See, it just started 1 or 2 months back. So that is something that is not dependent on German authorities. They send it back. They send your documents, for example, your Indian documents back to Indian authorities, or your degree back to university, and it depends on the time when they get the response and all those things. S-site proofing is a really new thing that has just started. So nobody knows about the timeline of S-site proofing. Okay. PR process is really easy. PR process for doctors, doctors come under skilled category. And for skill category, when your salary, you are blue card holder, that means when your salary is more than 4,200 euros, you can apply for PR after 18 or 21 months after tax paying.
Does this have to be an unlimited state?
Mm,
Does this, you have to spend certain amount of time in which you can't come back to your home country?
I'm just talking about 18 to 21 months of tax paid. That depends on that. So those rules for PR for unskilled workers, that is different. That 3 years you have to live in Germany, minimum 3 years in Germany, you must be 4 years working, something like that. For us, that is really, really short now. Instead of 5 to 8 years, we have only 21 months or 18 months. In 60 months, we get a German passport also when you want to apply. So that is that thing. So you can, I think so, apply after 18 months of tax paid, and within 21 or 22 months, you get the Niederlassungserlaubnis. That is thing. Okay, and when
So you
compared,
were talking about some question for the spouse visa.
yeah, I will come to that. Okay, let me just finish the application as a doctor, then I will come to other timeline. Say, so where were we? Let me look. Where were we? I'm a little bit lost. Okay, so now you have applied. Okay, you get a deficit beside. Okay, and with that deficit beside, you apply for visa application. Okay, that thing is done. Let me go back and see if something else is applied. Okay, yeah. So next our topic is directly visa application. So till visa application, now I will be starting with visa application process, not very detailed. Just how can you apply or which under which category you should apply. Okay. I just said no Indian translation is valid. You have to get it translated from Germany. No Max Muller Bourbon, no German embassy. Yeah, I'm beginning with that. I'm just waiting for the people till now. Till now, do you have any query? Okay, then we'll begin with visa application, and then shortly we'll talk about um, reaching there. I should not touch that topic. That is a long topic then, and that is not so much important. Uh, Maybe a little bit about FSP preparation, when to start, and I think so. That will be enough then. Already we have 2 hours to talk for 2 hours. Okay, so we don't have any queries till now. 1 minute. I must first somebody. Okay, priorities have we have talked about. Okay, EU doctors. So when you are a EU doctor, you only need to pass your FSP exam and you are appropriated. Okay, nothing else. Regarding two things, German PG is not valid in India. Okay, so that has two implications. But there are many German PG doctors; those are working in private sector. A colleague of mine is cardiologist, and he has an open from Medanta, that he can join Medanta anytime. Okay, so the thing is that with German PG, you cannot apply for government jobs as a consultant, as an associate professor, all those things. But the German health system is at par with the Indian system, so those techniques are not practiced in India. So private hospitals take you gladly. Okay. So I have many colleagues, or I know people, those came back from Germany and they're working in India. Okay. Not a problem. So you get offers in private sector, not a problem. But as such, nothing is recognized. You cannot apply for fixed positions, government jobs, and all those things. You have to just use your knowledge and resources, and hospitals take also. So, by example, orthopedic technologies of Germany are really advanced, so people take. That is not a problem. You can come back and practice. Good, not a problem. Okay. Then difficulties while learning German. How to work on German after C1. So that is. So I can only say German for you. For German, you have to practice and don't leave in between. Many people do one thing, that they must try to get B2 certificate. That is the ultimate goal. Okay. That should not be a goal. Don't stop learning. Okay. Don't stop learning. I just want to say one thing. Don't change your plans. Go whenever you want to go to Germany. But meanwhile, don't stop learning. Okay. Good thing with LP is that you can repeat even. When you don't want to learn the higher level, repeat that level twice. Okay. I would suggest that. But don't stop learning. Okay. Rest, it depends. You should talk. I did one mistake. I was a little bit of kind of introvert person. So I didn't, when I went to Germany, I was not so open. One, because of Corona. Second, I was hesitant to speak, that I wanted to speak correct German. That was my biggest mistake. I got a setback for 3 4 months. I wanted to speak correct German, but nobody will speak directly correct German. You have to speak uncorrect, and then you will correct yourself day by day, day by day. Till date, everybody I think so have done A1 with das. With das, while no, not with while, no, with das, my verb doesn't go to end till now. I speak a verb at second position with das till now. Okay, you speak, you make mistakes. Don't worry. People will laugh at you. Don't worry. But things that I am not able to improve my das, but around das, hundred of things have improved now. Okay. So my thing is that don't. You should be hungry to learn German. Then everything will be fine. Okay. Okay. German embassy in India. No translation from German embassy in Indian is also not. That is what I want to say. I have already told that all the options in India are not valid. That is, this question is asked again and again in my group also, in our group also. I want to say again and again, nothing in India is valid. You have to get that translated in Germany again.
So how do you find this translator?
There's a list of translators. There are 2, 3 translators. Okay, you just ask that those names of that group. You will get for with personal experience. She is good. He is good. He is she bad. Okay, only Indian people are using usually 3 translators. Okay, you will get those names. I will not mention the names on this platform. Okay, but you will get those names.
Somebody is there and want to apply on my behalf. So can I do that with the power of the
Yeah, you can do that thing. Okay, that is called Polmark. Polmark, power of attorney on Polmark. You give a Polmark, and he or she can inquire on your behalf. Obviously, where your signature is required, you have to sign that thing. But he or she can call on your behalf. Okay, inquire on your behalf. That is the thing. So you can give a Polmark, so-called power of attorney, to your known person in Germany, and he and she can do the documentation on your behalf or the inquiry on your behalf. But the things you need to sign personally, that you need to sign. Okay. Okay, before attestation, you have to get it translated from German. So again, a question: before attestation, you have to get it translated from German translation. Okay, I am explaining it again. Your German translator also attests those documents. Indian attestation from embassy is just to send a verified copy of your original document, so that you don't apply with original documents. One. Okay. So many people are having question again with translation and attestation. Okay, so I briefly explain how does it happen one more time. Okay, just a second. Indian PG is valid in Germany. Priorities. Okay. So I am explaining the translation process once more. Kindly focus now. Firstly, you get your documents attested from German embassy. The purpose for that is that you don't apply with your original documents, you apply for a certified copy of your original documents, so that you keep your original documents with you. The, the idea behind attestation from a German embassy in India is to save your original documents. That is okay. First thing is done. You got your documents attested, or you can send the original documents, which nobody has done, and I will also not advise you. Not also PCC or any other document. Okay. Second, now, in the meanwhile, when you are arranging for your PCC or your good standing certificate, which has a short validity, you get in touch with your translator. Send them the soft copies. She will send you the bill. You pay them, and she will begin with the translation. And when all the documents are arranged, you post those certified copies from embassy to this translator. She will verify what you have posted by mail with the certified sent copies, and then sorry, and then she will further translate them and issue them to, or send them to medical council. That translation is not only translation, that translation is translation along with notarization. Okay, the first attestation in India was just to save your original documents. That valid notarization is done by your translator itself. Okay. I don't think so. Anybody is translating only the scanned documents. Everyone asks for attested copy. Okay. Okay. So I think so that is clear. Yes, already sent my question on silent for different time. Yeah, when you applied for silent, then go for silent. Okay. When you applied for silent, then go for silent. Don't waste your time now changing the state. Okay. Now reach Germany, analyze the situation, and then go further. Okay. When you if you do anything now, change your state or something that will harm you. Okay. No problem. Silent is okay. So don't change your state now. Just go to Germany now. Okay. When you reach Germany, a lot of things change. Okay. So don't now use this option to get your visa now. Okay. I will suggest you that only. Coming to a very important document now, topic now, visa. So how can you reach Germany? Earlier I used to say three categories. Somebody asked me the fourth category today also. Okay. So earlier there used to be a language visa. Second was hospitation visa. Third is 16D. So fourth is FRV. So, and there used to be one category, job seeker visa also. That stopped in 2018 or 19. Okay. So, language visa, hospitation visa, job seeker visa. They were popular till 2018-19, where you used to get a language, you used to apply for B2 or a B1 classes, B1, B2, A2 classes. You used to get a language visa. You used to go there, pass, meanwhile apply for FSP, change your visa, and then go to 16D. Hospitation was same. You went to hospitation for 6 months or 1 year. Okay. Meanwhile you learned German. Change your visa to 16D. In the beginning, in 2013-14, people went on Schengen visa also and changed it to 16D. 13-14. Okay. Till 18-19, people used to apply for JSV, job seeker visa, you used to get for 6 months. Then at that time, for 6 months, Saarland and Hessen were really, really popular. Go there, apply for job, and then convert it to. But all these things are obsolete now. Now, whatever you ask for, they put you in category of 16D and ask for deficit beside. When you apply for language also, hospitation also, everything. Once in blue moon, one out of 100 to 1000, okay, gets get these language hospitation visa. About 99.9% they will ask you for deficit beside. Okay. And once you get a deficit beside, it makes no logic to apply for language visa, which is for 1 year, and that is not extendable. In most of the cases, you have to come back to India. Okay. Hospitation visa, that is extendable, but with problems. So once you have your deficit beside, which is meant for 16D, apply for 16D, from where you get 18 to 24 months of leave. Okay. Now, somebody asked me regarding family reunion visa. Okay. For family reunion visa, somebody asked me, will I require to do all this documentation? No. Just go through the protocol of family reunion visa, apply for that, okay, and reach Germany. You have to do everything, but irrespective of your visa, okay. Documentation and visa are not linked in. Okay. Visa you will use FRV, and documentation I mean for deficit beside order approbation. You can start before, after visa, also after reaching Germany. Okay.
It's the same thing for the spouse visa.
Yeah,
Like
spouse visa.
after Germany, we don't have to do all these documentation for deficit Bescheid.
No.
We have to
You,
start
you
just
have to do those documentation for deficit Bescheid about you need deficit Bescheid for visa application. When you
yeah.
apply for FRV, family union visa, then you don't need a deficit Bescheid.
Yes.
Then you will need your document from your spouse, his salary slip, his
Yes.
invitation, and all those things. That is totally independent.
So
Okay.
okay, our documentation will start for the FSP approval
You
for
mean,
my license.
yeah,
My documentation, if I say I have reached Germany,
yeah,
my documentation will start for FSP purpose.
yeah. You apply. You will always apply for approbation. You will not
So
apply
okay,
for FSP.
yeah.
You will apply for approbation. They will say, okay, in order to get approbation, you must have language this FSP, KP. Then you apply. Then you send your document that okay, I have this document saying I must pass FSP exam. I need an appointment for that and that. Okay, sir. Thank you, sir. Somebody is going saying thank you, thank you. Sir, please tell me more about 16D. So 16D visa is the visa for recognition of your foreign medical qualification. Okay, outside of Germany. When you are pass out from European Union, then you need to pass your FSP exam. When you are not a pass graduate from European Union, then you need either to do a Gutachten or you have to give KP exam. FSP is mandatory for everybody. For that, initially the guidelines are for the visa is for 18 months, I think. So you get a visa initially for 18 months. So that is how you get initially a visa of 3 months. Then you get an extension of 1 year on basis of your block count. Then you get an extension of 6 months to 1 year. Again, you have to show your block count again. That is the thing. So in the meanwhile, you get a time to pass your FSP exam. Then when you pass your FSP exam, either you can directly prepare for your KP exam or you can work. And then when you work, you get a permission to work for 2 years with two extensions of 6 months on an average. 3 years you can work and meanwhile you can prepare for KP exam. After 3 years, you don't get the permission to work. You have to sit at home and then prepare for your KP exam. Okay, how long does it take to take your deficit Bescheid? That was answered 6 weeks to 6 months on an average. Which visa to apply to get maximum stay? 16D maximum stay. Other visas you get short language visa, usually 6 months to 1 year, and that in many times is rejected for conversion. So I would suggest, okay, okay, there is a new category in Mumbai called healthcare category. Just focus on that healthcare category was earlier also. That is something different. That is when you get a direct job as some in healthcare sector. Do you understand? That is healthcare is a really broad thing. Okay, so that is totally different thing. You have to apply. Just see, at our time there was a category for recognition of qualification without intent of higher studies in Delhi. I don't know what our category is now. I think so. Now you have to send a mail. At our time, you have to select an appointment via slot. So I think so. Nowadays, you send a mail and then you get accordingly you get a visa category and appointment. I think so. Can anyone please text what sir told about German PG in India? German PG in India? I told German PG in India is not recognized, but yeah, that experience and technology is advanced, so private hospitals take you. Okay. So I have a couple of known people, they are working as a neurologist, one as a neurologist, one worked for a short time in India as a cardiologist and then went to New Zealand. Okay. So I know two people. Okay, was sind die Durchschnitte Posten mit Verweis auf das Verfahren sowie den Aufenthalt in Deutschland? Raj speaks sehr gut auf Deutsch. Sehr schön. Sir, is there any study visa? Study visa you don't get here. Like I said, here we have a totally different thing. Study visa is for when you go to university. So, touching this point, yeah, how to get for PG? Somebody has asked this question: how to apply in universities? So, post graduation in Germany for doctors is not academic. Okay, that is not academic, non-academic. That is non-academic. So what is post-graduation in Germany? Post-graduation in Germany is there are two type of jobs. One is just a job. One is job with PG Verfahren. Okay, that is most of the jobs are there of this category only in Germany. Like you say in Indian, it is somewhere said in AIMS. It is said academic JR and non-academic JR. The people who have worked in AIMS or such institutions in many hospitals, it is said in India also academic JR and non-academic JR, or the academic RMO and non-academic RMO. Junior JR means junior resident, MO medical resident medical officer. Same way. So you have to look for that place. So you apply for job with academic JR position. Okay. So you apply for that place. You send via email the copy or your CV to HOD, and you are invited to work. Then you have to work, and then you get those credentials. You have to fulfill those credentials, and then at the end of 6 years or 5 years or 4 years, depends on the branch and grade point, you have to take the Fahrkartprüfung exam. That is a PG ending exam. Also. That has also 3 attempts. You must that keep that in mind. Okay, exit exam, final exam. There is no entrance exam of PG. You just apply like in US. You do matching na by applying. So same way you have to get yourself matched. Okay, there you give FSMLE, USMLE. Here you give FSP and KP. Earlier your PG used to start after giving your FSP. So, but now your PG starts after giving your KP exam. So
You get a job.
job earlier before 2016, your backhead experience were counted in PG. So you pass your exam after 3 years KP. So the 3 years were included in your PG, but not now. That's because it's getting saturated, na? Little bit. That's because they have a doctor now. Earlier they didn't have doctors, so they promoted it. So that's the thing. How long does it take again to get a definite right? 6 weeks to 6 months. Okay, can you text me?
So
Okay.
can you outline the
What?
can you outline the path?
Path I followed. I explained that thing only.
No, like you did till C1 here,
Yeah.
then you applied for like how long it took, and then you went there and gave it.
Okay. Last in the दूसरी तो Boston हो गया. Boston. Okay. Yeah, that is also a good topic, but I have to think. I was not prepared for this question. Okay, sir, is there any study visa? Study visa is explained. Okay, so PG is explained, that is explained. Now, personal question, what all I did. Okay, so I started my preparation in 2019, started my German language. Initially, A1, A2 I did along with my work. Then I left my work or a job. And I think so after B1, I left my job. So because that was too hectic and I was only coming for weekends. So then I B2 and C1 I did full time. The meanwhile I applied for my visa interview that I got in 2020 beginning. Then in November December I was done with my documents, so I applied for deposit Bescheid and got my deposit Bescheid. Applied for visa. Okay, then in 2020 Feb. Then in 2021 of April I got my visa. March I got my visa. April I reached there. In April, I reached there. In September, I passed my FSP exam. Then, due to personal reasons, I stopped my studies and all those things happened. So now I'm preparing my KP exam and working. That's the thing. So my plan was to take my exam, KP exam in May or June this month, this time only. But due to personal reasons, it got postponed now. That was the thing. Okay. So visa is discussed. Yeah. Now costs. Okay. So cost. Firstly, you have to collect money for block count. And after reaching Germany, your block count is sufficient, I think so. You don't need to spend, you can take 2,200, 1,500 euros because with city registration and opening of block count, it takes 1 to 2 months. And you have to pay your rents and everything in advance in Germany. So you can take 2,000 euros plus block count is sufficient for everything there. Okay, when you save, so you can manage everything. Uh, FSP fees is 450 or 400 something euros. City registration is, I think, 13 euros. Um, Residence permit is, I think, so 100 euros. That you can manage everything in 2000 euros. Not a problem. Here, only your FSP fees, translation fees, 30 euros per document, average, maximum 30 euros. It costs 2022, depends on number of words per page. So translation, then language, that is normally. And one more thing, in the LP you can repeat everything again and again. In Germany, you're taught one time. That also not all the chapters. I have seen example in book they have 10 chapters, so they teach 6 or 7 chapters. That also one time. So try completing maximum of your German here in India. Okay, don't postpone your visit. I'm not saying that don't go to Germany till you learn German, but don't stop learning German. That is what I mean. Okay, that is really, really important. Don't stop learning German. That will help you a lot. And people say you will learn fast. Okay, so when you reach there, you've already done your C1. You will be ahead now. You will be learning more things. Obviously, you will learn little bit fast because you get a chance to speak more. That is good. That is understandable. But
Any recommended institutes for preparing FSP and
I,
QFP?
I hate this question. Okay, see, I don't have any much personal experience. One institute I can say is good is FIA, but that is expensive.
Yes.
That is expensive. That is the problem. It costs 3,000 to 3,500 euros. There's one more institute in Cologne, Medicine or the Medicine, something like that. Apart from that, I have to do homework on that. I have no idea.
I know only Pia. I have contacted them only.
That is,
know just
I can
one
assure one who
institute.
visits SPIA and attends classes seriously will surely pass FSP. But that is expensive. That is the thing. That is one thing I have to when I. The thing is that I don't research those things. I'm not interested as a profession. I just do for the sake of helping. So I have no experience of other institutes. So I cannot tell exactly. PIA, I can tell.
Yes.
So that is the thing. Okay, so any other question or can we take end it now? No, PG German is not valid in India. Indian PG is also not valid in Germany. You have to do your PG again. You will start begin for the first year. Okay, yeah. One more question somebody had asked for his her friend. No PG, German PG is not valid in India. In- a friend of somebody had written he or she is earning already 5 lakhs per month in India. So what should he or she do? See, you can earn more as compared to Germany and India also, being a postgraduate. I've seen people earning 10 lakhs per month in India also. It is all about that work-life balance. First thing, Germany. Second thing is social security. So when somebody is earning so high, then it is not about then more to change your professional life, then that decision will only be more to change your personal life.
Yes.
That is all. Okay. Regarding FSPA preparation, yeah, that's some people had asked me how to prepare for FSP. So preparing for FSP, you can divide in 3 parts. Okay. Personal, I can say 2 parts. FSP preparation. I will not go in detail, but because that is also personal work, the way I feel can not suit all the people. So I will not go in the details that you should do such. I can suggest you pathway. Okay. So in personal, what what all things have to be done, and professional. In professional, there are 2 things: hospitation that we have discussed, timeline and how hospitation, and coaching. Okay. Both of things are not mandatory. You can pass without hospitation and coaching also. It will be only little bit difficult and tedious. Hospitation helps you to better your accent understanding, and you can talk with patients. So that is again exact proofing stimulation or the proofing practice. Okay. Coaching as such can be helpful, cannot be helpful, depends on person, but it gives a direction. Good coaching institute gives a direction while giving you readmetals, practice sessions, and all those things. So that is enough. Personal, what should you do? Firstly, words or the word charts, okay? Medicine words. Learn those, okay? Then join groups, okay? And see what is happening. What is happening? You join the groups and see in the your state what is happening, what is the exam protocol, and find a study partner. What is happening? Every state has a different pattern exam. Somewhere you have to like explain those investigations, MRICT also. Somewhere empathy is important when patient says I have pain. So to show empathy, that is more important. So see, observe what is happening there in that state, okay, and then find a partner and practice. The most important thing, okay. Alone, this thing can help you pass. Practice with partner. Okay, the most important thing that helped me. Okay, I did hospitation also, classes also, these things also, but this thing helped me very, very much. 80% was this help. Just a thing, second. Okay, and there was one more thing in personal. Words. Yeah, timeline when to start. So when you are in between B2, okay, at end of B2 and C1, you can start learning these words. Okay, so when you reach Germany or near your, after remembering those words, you can start reading. Okay, reading what to read? You can read Ambos and DocCheck lexicon. DocCheck lexicon. Ambos is really detailed that we use for KP preparation. DocCheck is superficial, so you can begin with that and get into habit of reading. Okay, rest you can join the groups and you will get to know what to do, all those things. Yeah, B2 certificate, Goethe. Okay, so I told how I studied. All these are my experiences, personal experiences. Okay, okay, yeah. Telegram group, how you can join?
You can just search like Indians in Germany or Indian.
Right, FSP. FSP. First searching Facebook. Okay. In first, then Facebook you get in chats you get the links. Okay. And then you can write FSP preparation in NRWay, FSP preparation, FSP. One group is named. Just a second. Okay. I have just a second. I can tell you. I have just FSP/KP/approbación. Okay. /approbación. Yeah. Deutschland Verfahren. So you can search those, just write keywords, approbation, FSP. Once you enter one group now, you will get the links in those group. Go into the chats. German degree, yeah, that is a difficult question. I have not considered because I think Germany is enough. But Switzerland, you can go, Austria, you can go. Two countries I know. I have no idea. No point in giving wrong information. But in these two places, you can even go before your Pakat program exam. Like Switzerland, I think so takes after 3 years of German experience, you can go to Switzerland also, Austria also. Many of my friends go to Austria and for
Some people do like this, they put them to Austria.
That you can also do. Probation in Austria is a little bit difficult because you have to repeat 2 years, 2 semesters. It's not 2 years. You have to repeat three forensic medicine, Zravakranenia, what is Zravakranenia of India? PSM, and one more thing. How many times can we give FSP and KP? FSP unlimited, KP 3. When you don't pass in 3 attempts, come back to India. Okay, is B2 from TELC valid? B2 from TELC is also valid. Yeah. Apart from deposit beside, what do we need more to apply for 16D visa? All the list of documents. You just download MedBlatt from your state website, and then you go to the document list on visa, German embassy website, and you collect the list of documents. Okay, all these things are there. Your birth certificate, then your 10th, 12th, then your degree, mark sheet, passport, internship certificate, council registration certificate, good standing certificate, PCC. Apart from that, one or two more things. Okay.
So once
No.
we
KP exam is not for European degree. You just need to pass FSP and begin with.
so once we obtain our license, we can work in 27 Schengen countries, right?
I have no idea. Because in all those countries, do you want to get me? In all those countries, there's a different language.
Matlab dialect is okay, language is different.
Language is different. You can
language
speak
is
German
different.
only in
Yeah.
Germany, a part of Switzerland and a part of
And
Austria.
Switzerland also dialect is
I am
totally
living
different.
very near from Netherlands. There also you need English or a Dutch.
Dutch.
And Dutch is totally different. Dutch is totally different.
Yeah.
So maybe I think so. I'm not sure. You have to give something like FSP at least.
Yeah, we can work, but practically we cannot.
From
Practically
language
we
side, it is
cannot.
practically not possible.
Practically it's not
Okay.
possible.
So I think so. I've covered a lot of things, and I think so. All the queries are answered till now. So alles ist diskutiert geworden, yeah. So, any other doubt, or can we make all those people from live class? Okay. Hope the session was little bit of help.
So very helpful.
Okay.
Profession in another language. Like we can only imagine. Like,
Oh, we will discuss after that. Now, after the once I end this, then we'll discuss. Okay, so last it is 17:45 now. Last 2-3 minutes, I'm waiting for your doubts, and then I'll make it to end. Vielen Dank für Ihre ausführliche Informationssitzung im Zusammenhang mit FSP. Vielen Dank, Raj. Okay. Thanks, Sandeep, to you also for being patient and taking part. So done. I think everything is answered. Everybody's writing thank you. So then we make an end. I hope this session was helpful. A lot of our colleagues are in a group LP official for doctors. Okay, in WhatsApp also, in Telegram also. One last suggestion: get used to using Telegram. Some people had written we are not comfortable that much with Telegram. All the information regarding Germany will get more on Telegram, less on WhatsApp. Okay. So that's the thing. That's why I'm suggesting you. Once you go to Telegram, you will get so many links that you don't need to ask those things everywhere. So get used to of Telegram if you want to get more information. So that's all from my end. Have a nice evening. Okay. Vielen Dank.
Thank you so much, sir.